The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history physical is the starting point of a patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I listen to what they're saying, I look at their body language, and I feel them both physically and mentally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. To maintain a clean and safe environment, my office has several ultraviolet C wave lights to sanitize and kill bacteria and viruses. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Welcome to the show. Now, last week I discussed sexually transmitted diseases. Fantastic feedback on that show. Today, we're going to discuss erectile dysfunction, which is called ED, abbreviated ED. So from this point on, we'll say ED. Well, I have a special guest on the show. It's important to offer options on how we manage and treat ED. So I'd like to welcome Administrative Director of Revital Wave, Administrative Director Glenn Greeley. Glenn, welcome to the show.
Thank you, Dr. Tommy. It's a pleasure to be here.
All right. Yeah, it's good. This is something important because a lot of men, you could say over probably the age of 35, are affected by some percentage of erectile dysfunction, ED.
Yes.
Yeah, that's it. It's important. That's kind of like one of a talking points that we really don't discuss. You know, maybe to a special individual, like very close friends, but that's about it.
Yes, we do find that many men are a little bit apprehensive to talk about it, but once you open that conversation and start talking about it, that's when you find out about all the therapies and things that are available. And it is a legitimate medical condition. It's nothing to be ashamed of. It's right. It's going to affect all of us at some point from an evolutionary standpoint. We're all supposed to get older and
get older gracefully. Yeah,
exactly.
Yeah, well, that's why, when you have a really good relationship with your physician, you're going to be able to discuss this type of issue. You have like with my practice, my patients are my family. So I have a very open door policy so we can have an open discussion about this. If you don't have a close relationship, you're not going to bring the topic up, and then maybe the physician's not even going to bring that topic up.
Absolutely, I agree. That's why at Revital Wave, we try to create an environment where we can discuss this openly with the patient, get them on the right path and the right treatments and therapies that are right for them.
Exactly. All right, so let's define what erectile dysfunction, ED, is. ED is defined as the inability to get and keep an erection firm enough for sexual intercourse. So scientifically, this is how we're educated. We have what's called the sympathetic and parasympathetic outflow, and that's your central nervous system, and then your peripheral nervous system going down into your spine and going out into the organs itself. So to develop an erection, you have the brain where you're stimulated mentally, and then we have the actual physical touch. So there's two different systems working together. So we have initially the sympathetic outflow. That's where your heart rate goes up and you have increased blood being flown into the what we call the spongiosum tissue. That is the tissue in the organ itself, in the penis, that expands and it gets engorged with blood. After that, we have what's called a increase in parasympathetic outflow, and that locks in the blood until you're finished, and then that settles down, and then the blood gets drained by the penis, and then you become flaccid again. So this is we have an issue with that system there, and is what are the causes, which we will address this particular half of the show. So did you know that 1 in 10 adult males suffer from ED, and failing to achieve an erection of more than 50% is defined as erectile dysfunction, ED. That means that those individuals need some sort of treatment. But before we can treat, we must have a thorough history and physical with routine blood work. So let's go into some of the causes. Causes of ED would be a vascular disease, all right, and then we have neurological disorders, psychological state, trauma, and/or operations. So I'll go through each one. Well, vascular disorder. I did a show on diabetes and obesity, and we spoke about micro and macrovascular pathology, where we have increased plaque formation and you have hardening of the arteries. Therefore, you're going to have decreased blood flow going into the penis, and therefore we won't have the engorgement of the spongiosum tissue. All right. See, again, diabetes affects so many different organs in the body, and that's why it's so important to watch your weight and watch your diet and watch that sugar. Neurological disorders, and that'd be when we have the nerve impulses actually going into the penis that need to be stimulated. And starting from, let's go to the central nervous system, where you have diabetes, again, affects because of the microvascular pathology, but also multiple sclerosis and other neurological conditions can affect that nerve signal going from the brain down into the penis there. The psychological effects, that would be depression, lack of stimulus of the brain, or even performance anxiety, okay? A lot of times, especially if you're older, let's say you're in your 50s and 60s, you're starting to date again because maybe you were married, you get divorced, and you have a little time off, and now you're getting back into the dating game, and then you want to become intimate. Now you go, oh boy, she's 20 years younger than me. Am I going to be able to perform,
Yes, that's a big issue.
Yes. Trauma. If you have spinal cord injury, or even some sort of trauma to the penis itself, you're going to have decreased blood flow, and you're not going to be able to have engorgement of the spongiosum tissue. And then the last, again, would be operations. So if you have men who have operations on their prostate, their bladder, or even in the colon, may find themselves having ED. All right, so we have about 2 minutes left, and then we're going to go into the second segment where we're going to discuss what you have to offer. So since we're getting started, if an individual who is suffering from ED, or they think they have ED, and they'd like to reach you, how would they contact you?
So at revitalwave.com, that's the website. We're located right on Veterans Highway in Islandia, 1757 Veterans Highway. You can email us at info@revitalwave.com, or you can call the office anytime, 631-597-0000. And we have a staff of certified GainsWave technicians that can answer all of your questions, and we offer a free consultation.
Excellent. Well, that's wonderful. In the second half of the show, we're going to go and talk all about the services you offer to our community. All right, we have about a little bit more than a minute, so we're going to wrap out the first half of the show. Let me help you lead a happier and healthier life. Remember, if you wait, it's too late. I offer a very affordable concierge practice at the price of less than the cost of a monthly cell bill, which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. To learn more about my practice, go to drtomio.com. That's drtomio.com. Or give me a call, 631-980-8200. That's 631-980-8200. Again, Glenn, if they want to contact you, what's your information?
You can email us at info@revitalwave.com or call 631-597-0000.
What's your website?
revitalwave.com.
Excellent. So this is very important for men who are suffering for ED. You want to come in, you need an assessment, actually come to my office. We can do routine history and physical. We'll do lab work. We'll get a baseline. We'll get you over to see. And if you qualify for treatment, and which going into second half, we're going to discuss qualifications and treatment. Welcome back to the Dr. Tomio Show. I am your host, Dr. Thomas O'Brien. Today's topic, erectile dysfunction, which is called ED. So let's continue. I'm here with Administrative Director Glenn Greeley of Revital Wave. Glenn, let's continue.
Thank you, Doctor.
All right. So if someone has erectile dysfunction, or they think they have erectile dysfunction, what do they need to do?
So it's always a good idea to get medically cleared. Going to your office, you see the patient, you go over their underlying medical history to make sure that there's no issues that could prevent them from doing any type of therapy. And like you said earlier, you want to address the heart issues, if they have diabetes, blood pressure issues, anything that could be causing ED. So we want to take a look at that first. Once you do a blood panel and you've already reviewed their testosterone levels and PSA levels, and you make sure that there's really nothing preventing them from doing this type of therapy, that's where we come in.
Right.
So we offer several different modalities. One of the most popular things is the GainsWave procedure. So we're a certified GainsWave provider here, and it uses acoustic shock wave therapy to open the blood vessels in the spongy tissue and get that blood flow happening. Once we get blood flow into the penis and we get blood into that tissue, that's going to create new blood vessels, new cells, and it's going to allow that engorgement, which in turn is the erection. And we also have many patients who have trouble keeping an erection. Like you said before, that's part of ED. Some guys, they can get the erection, but they just can't maintain it. So by opening up those blood vessels, getting blood into that tissue, it helps them to maintain it longer.
Right. I think that's also psychologically as well. So they see a change down there, you feel good about yourself.
Oh, absolutely. Yeah. Without a doubt. A lot of the patients who come to see us, they're very apprehensive at first. It's a difficult conversation to have. As a consultant, I meet with patients, and a lot of times they tell me, look, I don't even want to discuss it with my wife. I'm trying to figure out how to fix this before it gets to this point. And I say, you know what, we need to have an open conversation about this. We need to discuss the options, what you need to do. And it's a legitimate medical condition that needs to be addressed. There's nothing to be ashamed of. It's going to happen. It happens to all of us. From an evolutionary standpoint, we are supposed to peak in our 20s, right? And then we are supposed to, procreate, recreate the species, and then wither out. Right. But we don't want to do that. In modern society today, we want to stay virile. We want to stay strong men, and we want to keep going. Exactly. And there's nothing wrong with that.
Yep. Well, we're living longer. We it is state that women live on average to 78, men 74. But with the improvement of the medications, specifically the hypertensive medications and the diabetic medications as well, we're living in our 8th and 9th decade now.
Yes.
So we definitely want to perform at our peak or peak performance, if you will, a lot longer in life. 6th, 7th, definitely decade.
Absolutely. Yeah. And that's where you were talking about earlier, some of the anxiety comes in. Performance anxiety is a big part of ED. So once we get the patient in and we explain to you why this is happening, and what we can do to treat it, you immediately will start to feel better about yourself because you know you're on the right path.
Right.
A lot of patients who come to us, they've tried medications. They've tried the PE5 inhibitors, and they either don't work or they have bad side effects. Some patients come to us and say, I can't take these medications because I have joint pain, I have bad headaches, and they just don't want to keep that cycle of medication. They just want to get healed. And that's what we're all about. These are natural methods of healing, non-invasive therapies, no side effects, and no downtime. So, for example, acoustic shockwave therapy treatment takes about 15 minutes, completely painless, non-invasive. It's a low-intensity sound wave that's introduced directly into the penis with a small handheld device by a nurse. And you start to feel something. Usually after 2 or 3 of these treatments, men start to feel something happening. And then there's a little bit of recovery time from that. And then the recovery is where you start building new blood vessels, new cells, new tissue growth. And then that's where you start to see the real results. So for most men, it's usually about 8 to 10 treatments to get you cured.
Right. Now, since you're talking, do you purchase a series, or is it one by one? Do you say a package of like 6 or 10 treatments?
Yes. So we have different levels. When I meet with a patient, we assess their individual needs and see where they are. For example, someone who we have it's called a performance package. Someone who isn't really experiencing severe ED, but they're noticing that they're not the same as they used to be. Well, we could probably do 6 treatments and get you back on that path where you need to go, and then do like a maintenance program. You could come in a couple times a year and just get a series of treatments like that. We have other patients who have severe issues. And we talked about earlier, trauma, surgery. So we have some patients who were in an accident, and they were during surgery, they were catheterized. And when the catheter was removed, there's some trauma to the penis, and now they're experiencing ED, or what we call Peyronie's disease, a curvature or painful erections. So we're able to treat that as well with the acoustic shockwave therapy.
Right.
And we've had tremendous success with that. So every patient is different. Some patients, on average, 10 to 12 treatments, they start to see a really good result. And we have some men that they see such a good result, they don't want to stop coming. They say this is working well. This is so great. They feel good about themselves. They're performing better, and we have like a maintenance program, so they can come back once a month or twice a month, whatever they prefer, and get an additional treatment. And we offer some other therapies available too. We're talking about blood flow. Blood flow is important everywhere in the body, not just in the penis. So if you're having ED, you could have blood flow issues everywhere else. So we incorporated another therapy along with this, red light therapy. Red light therapy is fantastic. Its clinical term, it's photobiomodulation. So that's light reacting with the biology of your body and making cells move and creating blood flow. Now, when we relieve oxidative stress with red light therapy, what we can do is get the cells to release nitric oxide. Nitric oxide is one of the things that every system in your body needs. And it is especially important for maintaining erectile function. So the first thing we do is we give you nitric oxide tests, see what your nitric oxide levels in the blood are, and then we get you on the right program. So with acoustic shockwave therapy, red light therapy, together. And we also use vibration therapy. You stand on a vibration plate, which gets blood flowing. We're able to get blood flowing, get your body to produce nitric oxide on its own again, using the correct pathways with the best supplements that I have been able to find. You and I have talked a lot about this in the past about supplements, and they have to be good quality. And that's what we have. That's what we're offering our patients. And we go above and beyond with these therapies. And like I said, it's all non-invasive, no downtime. Men can resume sexual activity the same day that they have their treatment, and no side effects. We also use a focused red light laser from Aspen Laser. It's state-of-the-art equipment, and we've had great success with Peyronie's disease with this. As you know, Peyronie's disease is scar tissue in the penis, and the Aspen Laser is able to break up that scar tissue and increase blood flow and straighten out any issues that they may have with a curvature or painful erections. So we've done a lot of research, and we've incorporated several modalities all together. It's kind of like, leave no stone unturned. Anything that can help get blood flow back, get the cells moving, create new tissue, we have incorporated that into our programs. So in addition to the Gaines wave procedure, we're using the superhuman protocol and red light laser.
Okay, good. Now, if a patient, we're getting ready to wrap up. So if a patient thinks they qualify or they do qualify because they know they have ED, what do they need to do? How do they need to, let's get a hold of you, set up an appointment.
So you can reach Revital Wave at revitalwave.com. You can go on our website and see all the information about all the services that we have. You can email us, info@revitalwave.com. You can call us at 631-597-0000. And of course, we always recommend giving us a call or an email to set up a free consultation. And working with you, Dr. Tommy, it's great that patients can come and see you to make sure they have no underlying medical conditions first, and then you can recommend them the right path to come to us for the therapies to treat what they need.
Excellent. I want to thank you, Glenn, for coming on the Ask Dr. Tommy O show and sharing your techniques and your business and what you're making a difference in the community. This is important. I mean, men's health. This is something that's not addressed. We need to address this. We address everything else, but we don't address men's health. I got 30 seconds left. I just want to say, let me help you lead a happier and healthier life. If you wait, it's too late. Don't wait for this. Make that phone call. Call Glenn. Call Revital Wave. Make that call now so we can make a difference in your life. This will improve your way of life. So give me a call at 631-980-8200 or visit my website, drtommyo.com.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.